In this video tutorial, we're going to create essentially a workflow. We're going to do a virtual treatment plan at site number 9, as well as for site number 12, using the EZ3DI software. We'll start by left-clicking and going to the 3D pan module of the software itself, and then left-click anywhere inside that green box, which is our navigation pane, to identify the first site, which is in this case here, site number 12. Now, while the patient is still sitting in the chair, we can easily assess whether or not the patient is even a candidate for doing an implant. I can see my bone width between buccal and lingual cortical plate, and if I rotate my view and essentially create a sagittal view, now I can see both tooth numbers 11 and 13, where I can even measure the occlusal space between those two teeth. I can then take my navigation pane and move it over to site number 9, where I'm going to do an extraction, assess the site there as well, looking buccal lingual, generate a measurement, and again rotate around to essentially create a coronal view where I can see tooth numbers 8 and 10 to evaluate the spacing that I have there as well. If I've decided the patient is an excellent candidate for doing an implant at both sites, I can then begin my treatment plan. I'll hover on my mouse on top of the section view, hit the Enter key, and then click on the measurement tool, measure buccal lingual, and then measure from the occlusal up to the apex at number 9, and then perhaps from the occlusal up to the sinus as well. I'll left click on the dimensions to move them out of the way, and then from here I'll navigate over to my implant icon. We can left click on the Insert Implant icon and then move the window to the top of the screen, and then starting from the top, left click on tooth number 9, verify our company, lineup, and our implant size, and then click on Insert. Click to move the window off to one side, and then left click at the occlusal site of our implant. Left click on the implant itself, and then left click to drag to rotate the implant into proper position. You can right click on the implant again and go to Property to add a crown. Select the Enter key to go back to our previous layout, and then hit the spacebar to hide the navigation window. Right click and then select Show Controller, where we can then rotate the crown itself to align with the rest of our dentition. We can left click to move it bodily, and also adjust it in the sectional view by left clicking and then dragging our mouse to rotate the crown to match the existing tooth in this case. If we right click, we can also edit the crown where we can change the height. In this case here, making it shorter. When we're done, click on OK to save those changes. Select the Enter key where I can then fine-tune this virtual crown with the existing tooth even further. When done, hit the Enter key to go back to the previous layout again. In the 3D pan, I can right-click, go to Edit Crown, and then from here I can adjust the width of the crown to match between teeth numbers 8 and 10. When I'm finished, hit the OK button at the bottom of the screen. And then left click to move it bodily between teeth numbers 8 and 10. I can left click then to rotate it up to make sure that the incisal edge matches between teeth numbers 8 and 10 as well. To verify my placement, I can rotate my sectional line to match the angle of my implant. I can then left click on the navigation pane and then begin working on site number 12. I can rotate my sectional lines again to match, in this case here, the angle of teeth numbers 11 and 13. Identify the site where I'm going to then place my implant. Hit the Enter key in the keyboard to give myself a larger working space. Click on the measurement tool and then measure from the occlusal ridge and then measure from the occlusal ridge up to the sinus floor. Left click to move the measurements out of the way. And if I want to, I can also assess the quality of the bone by using the Profile tool. By left clicking to activate it, and then make a left click at my starting point, in this case here in the buccal cortical plate, and then click again on the lingual cortical plate. And then from here, I can then left click and move the window out of the way. And then as I hover the mouse on top of the graph, you'll see a vertical white line on top of the anatomy to identify the density category as you're scrolling, in this case here, from buccal lingual. I can do the same thing going from the ridge up to the sinus floor as well. Left click once and then left click again at the sinus floor. Hover the mouse across the graph and you'll see a horizontal white or gray line going vertically from the ridge up to the sinus floor. When I'm done, hit OK again. I can left click to move these measurements out of the way, or if I'm done with them, I can also right click, select delete, right click, select delete, and get rid of those dimensions and density values. With these two dimensions, I can then choose what implant I want to place. Click on Insert Implant. Again, choose my tooth number at the top of the screen. Select the drop-down under my company to choose the manufacturer. In this case here, looking for a Glidewell Han implant. Choose the implant I want to use, and then click on Insert. Left click to move the window out of the way, and then left click again where I want the occlusal end of the implant to be placed. In this case here at the ridge. If I left click on the implant to make it active, I can then left click on the red axis line to adjust the angle of it. If I want to verify the height that I have to work with, I can actually edit these dimensions, such as this vertical dimension, and change it so it matches the angle of my virtual implant. If I right click on the implant here, I also have the ability where I can bring up the information, which will then verify the virtual implant that I've placed. If I want to save that and use for case presentation purposes, I can left click on the camera, navigate over to the EasyDent Eye software, click once to refresh my patient database, and now I have a screenshot of that completed treatment plan. Back in the EasyDent Eye software, if I right click on the implant again, go to Property, I can left click to move the window out of the way, put a check mark in the crown box, left click on OK again, and now I've added a virtual crown. To make changes to it, I can right click on it, go to Show Controller, and then rotate around so the cusp will then match properly in both the 3D pan, and I have the ability where I can do the same thing in my sectional view. Right click and then go to Edit Crown, where here I can then change the height of my crown. And when I'm done, click on the OK button at the bottom of that window. I can left click inside the navigation pane and slide the window over towards site number 9. Bring the mouse down into the sectional view, select the Enter key to enlarge that workspace, and then make some final adjustments to both the crown and the implant if I need to. I can then right click on the virtual implant, select Show Info, and then click on the camera in the toolbar. From here, if I navigate over to the EasyDent Eye software, left click to refresh my patient database, now I have a snapshot of that implant that placed at site number 9 along with the implant manufacturer. A tool in the software that's used quite often is called Oblique. And what I'm going to do here in this case is align the coronal line through the center of the implant in my sagittal window, and then I'll adjust the sagittal line through the center of the implant in my coronal window. And then down below in the axial window, make sure everything's lined up through the middle of the implant there as well. I'll click once on the oblique tool, click once at the center of my implant, And now I have a cross-sectional view going right through the middle of the virtual implant at site number 9. I can zoom in and zoom out by left-clicking on the green boxes. I can left-click on the implant to make final adjustments between the two teeth here. And as I left-click and then rotate around, you'll see how the virtual implant is staying virtually stationary and the anatomy is essentially rotating around it, to the point where I now have a view looking buccolingual. And rotate around. Now I'm looking at it from the palatal aspect and continue rotating around. We're looking at buccolingual from the right hand side. When I'm done there, I can hit the reset button and we'll do the same thing now for site number 12. I'll adjust my coronal through the center of my implant in my sagittal window. And then I'll do the same thing as far as adjusting my sagittal line through the middle implant in my coronal window. Click on oblique and then click once on the center of the implant in my scout window or axial. Left click to rotate around, where again the implant will stay stationary, and now I can look at the relationship on my implant between teeth numbers 11 and 13, as well as looking at it between the two cortical plates here. Rotating around again, looking at it from the lingual aspect. And when I'm done, left click to turn off my oblique tool. Click on the reset button to restore my axis lines. For case presentation purposes, I can take these images that we took earlier and use this as case presentation and also education for the patient. I can left click and bring up a video as it relates to the treatment plan identified on the left hand side of the screen. We'll then show an education video to identify the proposed treatment plan for this particular patient. In this case, we're showing a flap type surgery where we're showing our pilot drill, followed by our series of drills to drill for width and depth for our implant, showing the healing cap on there, and then restoring with a final abutment and our crown. At site number 12, we have something similar we can demonstrate to educate the patient what could potentially happen if they let the site go untreated for an extended period of time. In this case, we'll navigate over to the left-hand side under where it says Implant Dentistry and choose Maxillary Sinus Lift. Left-click, bring a video that would show what would happen if this site remained edentulous for an extended period of time to the point where you would need to do a sinus bump or a sinus lift or augmentation, add artificial bone before placing the implant itself. In addition to the treatment plan for doing 2 virtual implants, we also have an opportunity where we can look at the scan for secondary findings. Such in this case, we're looking at site number 14, where there appears to be communication going on within the sinus cavity. Where we go to our annotation tool, left click, draw a circle around that area of concern, and then left click on the camera to save that as well as use for case presentation. We can rotate our view to generate a sagittal view of our anatomy. Select the Enter key on the keyboard to maximize our workspace. Go back to our pencil in the annotation section. Left click and draw a circle around that artifact as well. And then left click on the camera to document it. Select the Enter key to go back to our previous layout. And then left click to drag the navigation pane over to site number 4, where it appears to be communication between the root and through the buccal cortical plate. Select the Enter key to maximize our window, use the center wheel to scroll mesial distal, and then use our marker to identify the area of concern. And then lastly, click on the camera to document it. Going back to EasyDent Eye, we now can use these screen captures as part of our case presentation to the patient. There's a video under the development of disease, and use that video to help educate the patient as far as what could be the potential cause for the communication either in the sinus cavity or in this case here through the cortical plate in the maxillary arch.